Hello, my name is Dr. Mazoon here at United Dental, and I wanted to answer some questions regarding dental implants. We've been getting some questions about that. So what are implants and when are they recommended? Dental implants are titanium screws, if you would, that are placed inside the bone, and that helps to replace a missing tooth. So the condition that would disqualify a patient from getting an implant would be if they didn't have enough bone for that titanium screw to really integrate to, then that would definitely disqualify the patient. These are things that the oral surgeon would have to evaluate through x-rays and an examination to really determine if the patient is a good candidate. The benefits of dental implants are very clear in that only that missing tooth is replaced. The dentist doesn't have to touch or prep the adjacent teeth in order to replace the missing tooth, as we would, let's say, for a bridge. An implant just replaces that one missing tooth without touching the adjacent teeth or weakening the tooth structure of the adjacent teeth. Different types of dental implants, we use the titanium screw. Some are with the zirconia crown. Some are the metal to porcelain crown. Routinely in our practice, we restore the implant with an implant crown that is zirconia. We find that the material works really well, and it looks very aesthetic and natural as well. So again, the dentist, the oral surgeon who will be performing the surgery on the implant would decide if the patient is a candidate for an implant. And that's again through a very thorough examination with x-rays. And only that if they think that the patient is a good candidate will the surgery be performed. The steps in a dental implant are, the first step is with the oral surgeon. When they would place the titanium screw into the bone, then we wait for the healing process. That should take sometimes up to a few months. Then after we get the okay from the oral surgeon, I myself would restore that with an implant crown that gets screwed into the implant. So it's a two-step procedure. There are other ways to replace a missing tooth, like a partial denture, a removable partial denture, or a bridge. But we find that with partial dentures, the patient's really never that happy with it. It moves around, food gets in under, and we find that that is the least favorite treatment plan for a missing tooth. And bridge, as I mentioned earlier, you do have to prepare the other teeth, the adjacent teeth to that missing space. And again, you are jeopardizing the integrity of those teeth to replace the one missing tooth. So implant by far is the best option if the patient is a good candidate. The dental procedure for the implant usually takes about an hour for the oral surgeon, and the impressions that I would do take less than half an hour. So it's a very fast and efficient procedure, and it doesn't take that long at all. Anesthetic, we get questions about the anesthesia. Do you have to be put under general or IV sedation? No, we do all of the procedure with just local anesthetic. Lidocaine, same thing we use when we do a filling, and patients don't feel anything at all. And dental implants can last a lifetime if the gums are healthy and the patient has a good oral hygiene and they're coming in for their 6-month recalls and they're getting their cleanings routinely done. There is no reason why the implant shouldn't last a lifetime. The only reason that it would fail is if the patient does get gum disease around the implant, and that would cause the implant to fail. So the cost of an implant with the implant crown, we're looking at about $5,000 to $6,000. We do offer financing in our office, so that makes it very affordable to make monthly payments. Sometimes if the patient has a good credit score, 0% financing, and they can just finance their treatment. Some insurances do cover part of the implant. Maybe the implant crown can be covered partially. That's a case by case, insurance by insurance. So we'll be more than happy to check eligibility with your insurance and have you come in and give you a very accurate estimate on cost. And the appointment will be an evaluation initially with the oral surgeon. Once that's done, then we can set up the surgery appointment and take it from there. Thank you for your time. I'm hoping that I answered all of your questions. Thank you. Bye-bye.